Hello, I'm Nancy McClernand, President and CEO of the Global Business Alliance. Given the extraordinary moment we find ourselves in, we thought it was really important to spotlight the ways our companies have stepped up to combat the pandemic. From the very beginning, GBA started cataloging how our member companies were responding to COVID-19. You can check them all out on our website at globalbusiness.org, but today I want to spotlight 5 that are emblematic of the way international companies have stepped up to support their communities, first responders, and America's most vulnerable during these challenging times.
As the coronavirus spread, producers and supply chains struggled to keep up with the increased demand for hand sanitizer, leaving communities without this critically important product. That's when Anheuser-Busch employees at the Baldwinsville, New York and Los Angeles, California breweries quickly set out to transform the manufacturing process and ingredients to immediately produce hand sanitizer and deliver it to those in need. In partnership with the American Red Cross and local government organizations, Anheuser-Busch donated 500,000 bottles of hand sanitizer to frontline workers across 20 states and Washington, D.C. This fall, building on its hashtag Brew Democracy Initiative, Anheuser-Busch donated 8 million ounces of hand sanitizer to state election offices in 40 states across the country to ensure election officials and voters could take part in a safe election. Last spring, as the pandemic began, a challenge was issued to data scientists: create AI tools to help medical researchers and practitioners find the information they need in the rapidly growing set of COVID-19 medical research. Ericsson volunteers answered the call.
We sent out an email calling for volunteers. We thought we'd get 20 or 30 hands up, instead we got about 400.
They formed teams to develop a set of AI-driven tools that allow medical researchers to ask specific questions about topics like risk factors or non-pharmaceutical interventions. The tools find and summarize the most appropriate papers to answer the researchers' questions from what started as a set of roughly 30,000 papers and has now grown to over 200,000 papers, more than any researcher could possibly read through.
A resource like this that can synthesize all the available knowledge and boil it down in a way that allows me to have actionable insights and also trust that it's coming from my medical community, the source of high quality information, really helps guide me and make the best decisions I can for my patients.
The tools have been released into open source, enabling doctors and researchers to quickly find the information they need to lessen the impact of this virus. As Americans fell on hard times, with many losing their jobs at the onset of the pandemic, local food banks faced a shortage of supplies to keep communities fed. Nestle saw this as an opportunity to act on its purpose, to unlock the power of food to enhance quality of life for everyone by feeding the most vulnerable in communities across the country. Since mid-March, Nestle has broadened its base of key partners to include the American Red Cross, James Beard Foundation, Meals on Wheels, No Kid Hungry, pet welfare organizations, hospitals across America, and more. To date, Nestle's U.S. brands and businesses have donated a combined $6.9 million, 6.5 million pounds of food, and 10.3 million bottles of water to charities, food banks, and nonprofits in the communities in which it operates. Additionally, within the company's walls, supporting its employees' well-being and health has been a top priority and has allowed Nestle to prevent outbreaks and keep grocery store shelves stocked at a time when consumers need it most. Siemens USA has continued its commitment to supporting states and communities in the fight against COVID-19 and its devastating impacts. Siemens USA is focused on ensuring that no American or any community is disconnected from essential services, and right now, no service is more essential than healthcare. Faced with COVID-19's devastating effects, the Siemens Foundation rapidly pivoted its focus to health equity and provided a total of $2 million in critical financial aid, including funding from Siemens Healthineers to sustain the work of 20 community health centers across the country that are meeting the healthcare needs of those who are disproportionately poor, chronically ill, and disenfranchised. The Foundation is committed to supporting these critical healthcare providers so they can continue to serve their communities, recover and rebuild from the pandemic, and promote diversity, equity, and inclusion in communities most affected. In total, these grants reinforce Siemens and the Foundation's resolve to support communities across the U.S. in the face of this crisis. Volkswagen formed the Community-Driven Promise Initiative in March to address the financial concerns of its customers, the need for personal protective equipment in hospitals, and the challenge of providing essential supplies to vulnerable communities. Volkswagen Credit employees adapted payment systems to support financially insecure customers, while Volkswagen purchasing, production, and engineering executives worked with suppliers to adapt operations toward relief efforts. Volkswagen's strong relationship with Forcia allowed the companies to transform manufacturing to produce an estimated 250,000 masks and 50,000 gowns each week that were shipped to hospitals across the country. Volkswagen Chattanooga made use of its education labs to 3D print mask holders for medical workers in the region. Volkswagen also supported over 600 independent U.S. Volkswagen dealers who put their service loaner fleet to use for free pickup and delivery of needed supplies and food in their communities. Volkswagen employees from all different areas of the organization brought their various skills to the table to work toward achieving the community-driven promise throughout the pandemic.
As you can see, each of these stories exemplify how employers around the country have pulled together to help combat COVID-19, but we can only have one winner, and while no company undertakes something like this for the recognition, we could not let such an undertaking go unrecognized. So the company we would like to acknowledge for their outstanding response to the COVID-19 pandemic is Ericsson. I'm joined now by Nicholas Hooveldop, President and CEO of Ericsson North America, to discuss Ericsson completion of the COVID-19 challenge and the innovative work Ericsson has been involved in throughout the pandemic. Hi, Nicholas, and congratulations.
Hi, Nancy, and thank you so much. And thank you to the Global Business Alliance for recognizing Ericsson here today. I mean, we truly value our partnership with the Global Business Alliance, and we do appreciate everything you do for international companies in the US, such as Ericsson. And it's, of course, a great privilege to be included among outstanding companies across multiple industries in the celebration. And it's a true honor for me to now accept this award on behalf of Ericsson. I mean, we pride ourselves for typically being out early when natural disasters and crises hit. Ericsson has a long-standing track record of working with first responders. We have a collaboration with the Red Cross called Ericsson Response. So we have come to appreciate over the years that our employees show up in strength and mobilize around crisis. But it's been great to see that we had close to 400 volunteers sign up for this particular challenge. And the credit really goes to Paul McLaughlin and the Ericsson volunteers that stepped up. And I'm incredibly proud of our team. So thanks again for recognizing us here today.
Yeah, that's great. So Nicholas, let me start off by asking, how has the COVID-19 pandemic affected your company?
Not much, I would say. I mean, we're really a part of the solution more than the problem. So we are, I guess, are privileged in the sense that our technology, our solutions are a big part of the solution. And we've had about 85% of our employees, both globally, but also in North America, work from home. And we've been able to keep the operations up and running without really missing a beat. And I'm really proud of how the team has stayed close to our customers, all of which provide essential communications networks, and supporting our customers and our partners to keep the networks running. We ran a big campaign, Keep America Running, which I know is of great pride to our employees. And we stay focused on public safety, healthcare, schools, businesses, and have really, I think, been fortunate in that sense that our technology, our solutions have been an important element of keeping the communications up and running during this pandemic.
So what do you think it was so important for Ericsson to get involved in the challenge to begin with and lend its expertise to help the biomedical industry sift through the enormous volumes of COVID-19 data?
Well, I think it goes back to culture, our DNA. We were founded in 1876 on the premise that communication is a basic human need. So we've always taken pride on getting engaged in our local communities. And as I mentioned, we're typically first out. We're the first responders during a natural disaster and the crisis. In this case, it took an entrepreneur, Paul. He saw the opportunity. He saw the fact that we have great expertise in the areas of artificial intelligence, machine learning, data science, and he mobilized a team across the company of about 360 people to step up and to respond to this challenge. We knew we had the expertise and we could make a difference. And again, I think these type of crises do bring out the best in a company like Ericsson. It's deeply ingrained in our DNA, and people do care. People do enjoy stepping up and voluntarily engaging in making a difference when they can.
Yeah, absolutely. So before I let you go, can you talk a little bit about other ways that Ericsson has contributed to U.S. communities throughout the pandemic beyond the COVID-19 challenge?
Right. So that's, I guess, our core business. So it's building communication networks. So staying close to our customers, keeping the networks running has been our number one priority. And we have seen significant challenges for many customers where the traffic patterns in the network shifted significantly. So as opposed to working in offices in urban downtown areas, people have been working from home in our suburban areas instead. So that has changed the patterns in the communication network. So we've had people out in the field consistently throughout the crisis, working with our customers, making sure that we have the right capacity and technology in the right place. And that's at the national level with the big carriers. And then with some of our smaller rural carriers, we've actually gotten even more hands-on. I love the example with Vermont Telecom, where in the Rutland School District, we concluded that kids actually did not have communication services at home. So we partnered with a carrier and a device manufacturer, and were able to equip students with devices and connectivity so that they could study from home. And I think it was over 2 weekends, basically 10 days. And there is plenty of examples like that where we sort of step up and work with our customers to make sure we can provide essential communications. I think some of the studies we did point to about 30% of our students in the US not having access to broadband connectivity and are obviously being at a disadvantage. So if anything, I think this crisis has exposed the divide and some of the social injustices. So a lot of more work remains to be done, but I think there's a good burning platform, I guess, now that we can continue working on way beyond this particular effort. So thanks for asking.
Yeah, that's terrific. So Nicholas, just thank you for joining us this morning and talking to us a little bit about all that Ericsson has been doing. You've been doing some incredible work, and we appreciate all of it and helping us all emerge from this crisis. So thank you.
Well, thank you. And I guess it's my privilege. I'm super excited and very, very grateful of this recognition. It means a great deal to us. But really, for me, it's an honor to accept it on behalf of Ericsson, and the award and the recognition should really go to Paul and the team that he has mobilized, our Ericsson Awesome employees across the company. So with this, I want to hand over to Paul. Congratulations to you and the extended team. Thank you for spotting the opportunity, and thank you for mobilizing Ericsson so that we could make a difference here again. Thank you.
I'm also joined now by Paul McLaughlin, AI research leader and head of the COVID-19 AI research project at Ericsson. Hi, Paul, and thanks for joining us.
Hi, Nancy. Thank you, Nicholas, Nancy, and the GBA. It's really a great honor to accept this award on behalf of our team.
Paul, what struck me about this initiative was its unique approach to COVID-19. What led you to tackle this particular challenge?
It's a great question. If you can think back to March, there was just so much uncertainty about what was happening with COVID-19 and what was going to happen going into the future. So we saw that the US government had asked for data scientists and technology leaders to get involved in trying to provide answers and to find insights on how to tackle this virus. So as Ericsson has invested in AI and data science and our leadership in those spaces over the past decade, we thought this was a really great opportunity for us to bring that leadership and that experience to bear. So we wanted to contribute and really build on some of the initiatives that citizen data scientists were working on. But once the U.S. government really asked for help, we wanted to really bring our skills and experience to bear.
What has been the response of some of your colleagues at Ericsson?
I think that's a really great question because it gives me the opportunity to talk about our incredible volunteers. We sent out a call for volunteers on a Tuesday afternoon, asking people to consider volunteering their time and their energy on, outside of normal working hours. Because of that, I thought we would get maybe 20 or 30 volunteers. Instead, we got nearly 400 people
Wow.
who were, just working with all of their passion and energy. So we had meetings at 2 o'clock, 3 o'clock. We had colleagues from the United States, but also from Canada, from Sweden, from India. People would work for 24, 48 hours straight just because we knew the importance of the work we were doing and also just had a real passion and a way to give back to our communities that were suffering and really scared. And this really gave us a way to have a tangible, meaningful impact for the better, I hope.
Yeah, that's amazing. What were some of the tangible results from this endeavor?
So again, back in March, this is a virus that the world has never seen before. So the world research community was just producing an incredible amount of case notes, academic papers, insights into this virus. And the real challenge is just how, for clinicians, for researchers, how do you make that information accessible? How do you try to find key insights inside of those papers? And so that's what our task was. We were asked to do what's called information retrieval, which is a form of data science where you try to extract meaningful insights from text documents. So in March, when we started, there were about 30,000 papers published on COVID-19, just way more than any human could possibly read. I believe that number is now over 200,000 papers. So just a staggering amount of research to have come out in a year's time. And so our main tangible result is releasing our tools into open source so that anyone in the academic researcher community can use them and contribute to them. And hopefully it will cut down, I hope there's never a pandemic like this again, but these tools will hopefully cut down the time between a new pathogen emerging or a new crisis and the ability for medical researchers to find key insights into the future.
So I'm wondering what happens from here. So do you envision this project continuing to evolve over time? And can you speak to the role that you see AI playing in other areas of research in the future?
I think that's a really good question. So volunteers, of course, continue to maintain the code and make sure that it is supported. I envision AI as being really a powerful tool for us to find information. So as I mentioned, there's just no way for any human to read 200,000 papers, let alone retain the information or find patterns in them. It's just too much. You might be in the library for the remainder of your life reading these papers. So what I really find AI to be is a tool for us to augment what humans are doing, the incredible training that medical researchers get to understand material, to really augment it so it can bring patterns or insights to their attention sooner or more quickly. And particularly when we're talking about a crisis, any additional day or hours can really help save lives.
Yeah. Yeah, well, Paul, thank you so much. Congratulations on getting this award, and we really appreciate all that you've done.
Thank you. And on behalf of all of the volunteers who worked, as I said, just so incredibly hard, I am just so proud of them. And all we can say is thank you so much. And thank you so much for this recognition from all of us. It is so incredibly meaningful, and we are exceptionally grateful to you and to our leadership at Ericsson for this opportunity to give back.
Paul and Nicholas, thank you so much for your time. Ericsson's contributions highlight the many ways that international companies are working to help defeat this disease. So thank you.